I'm Dr. Kathleen Mohlman. I am a small animal veterinarian currently. I have practice and mixed practice too, so I did practice on horses and cows and everything for a while when I first graduated from school. My day-to-day life at work, I work for a small animal practice. We see dogs and cats primarily, but we do see reptiles and small rodents. I do not personally see small rodents because I'm allergic to all of them, but my coworkers do. And I work either 4 or 5 days a week. I alternate because we're open Monday through Saturday, so everybody works every other Saturday. So this is a 4-day week. I'm always off on Tuesdays, which is nice. So I have stuff, I can do stuff when everybody else is at work, which I enjoy. 2 days a week I do surgery, anything from just spays and neuters to removing spleens or tumors, or if your dog swallowed a golf ball, I take it out. And also dentistry work on dogs too, because a lot of them break teeth or have infections in their mouth. And then 2 or 3 days a week I see appointments. And probably some of my favorite parts of the job are, well, I do love surgery, that's why I do it 2 days a week. That's uncommon in a small animal practitioner. Usually I'll do it 1 day a week. But I also like seeing the appointments. I like seeing the puppies and kittens and growing a bond with the dogs, and then as they get older and grow older with you, you get to know the people along with the pets, and it's nice. It's that's probably my favorite part is, obviously the healthy pet visits where it's all good stuff that we're talking about. The harder parts is when they are having severe, health issues, when they get to the point where their quality of life is poor and we have to consider euthanasia. Those are probably the hardest days at work. Or when, unfortunately, in veterinary medicine, since there's not many people have pet insurance, when we have to balance finances with care too, because in a perfect world everyone could afford everything and take the best care possible, but sometimes you have to work with what you have. My favorite patients to see, don't tell Hamilton, are probably Labrador retrievers and golden retrievers, because they always love to come see you. They don't care what you do to them, they still love you. Although we do see our share of pets that have, that are fearful or sometimes even aggressive, which is a little tricky part of my work. I think I've always wanted to be a veterinarian. In first grade, my first grade teacher's husband was a veterinarian and came and talked to us in class, and I went home and told my mom I was going to be a veterinarian. Both my parents grew up on farms, so I got exposed to a lot of the farm animal life at my grandparents' house, and I started working for a vet when I was in high school here at Carroll High School. I worked at Woodman Animal Hospital, which I don't even think any of the vets are the same people as they used to be, which is walking distance from here. I used to walk from Carroll when I didn't have a car. So great experience. I always enjoyed it, and so I still enjoy it. I've been a vet for 20 years now. I had my 20-year veterinary reunion last year, and I still learn something every day, and still can, there's always new technology or new ways of doing things that I keep learning, which is awesome. I have some younger vets that I work with that have graduated in recent years, and it's cool to see what they tell us what they are teaching in vet school now, and we share our history and overview of what we've done through the years. The place I currently work has 6 veterinarians, which is a pretty big practice. I don't have any idea how many patients we see a day. A lot. I probably see, on appointment days, I probably see about 25 patients a day. But I keep a pretty quick pace too. So I went to Carroll High School. I graduated in 1994. Then I went to University of Dayton. My dad worked for University of Dayton, so that's how I chose that school, because I got a break on tuition. I got a Bachelor in Science and Biochemistry. I wasn't 100% sure I'd get into vet school, so I wanted to have a backup plan, and I thought biochemistry would give me a little bit more options job-wise if I didn't go to vet school. It was a lot harder. I should have stuck with biology or pre-med, because then I could have just gotten my prereqs for vet school and not taken, engineering level calculus for 2 years. And so maybe in hindsight, I don't know that I'd recommend doing a biochemistry degree unless you really like chemistry. But I did really like chemistry when I left Carroll High School because our teacher here was awesome and I was super excited about chemistry. And then I went to Ohio State for veterinary school, which is the only veterinary school in Ohio. There used to only be 37 vet schools, but I think they've opened a couple more. So I think there's like 40 or 42 now in the United States. So it is very competitive to get in. The average class size is about 100 people. It is harder to get in than human medical school, but only because there's a lot more medical schools. Like you still have to have the same level of good grades and all of that stuff to get in. So, I went to Ohio State. It did take me 2 tries to get in, which is the norm. Most people do not get in on their first try. I did get an interview on my first try, so you have to have a certain GPA in science classes and in just overall classes. You have to have some work experience in veterinary medicine. And I had worked for a small animal vet. I also worked at an emergency veterinary hospital as an assistant there. And then I also did some ride-alongs with a large animal vet trying to get a well-rounded experience, which they really like for vet school. And then they also want you to show that you have participate in other activities, you have some leadership. They don't want you to say, oh, this is hard and I can give up and quit vet school, because obviously at Ohio State there's 130 people in each class and they want to keep all those people. And you have to be able to be somewhat, outgoing and talk to people as a veterinarian. Most of my day is spent talking to clients and returning phone calls from clients, and you have to be able to do that in order to excel. There are some days I go home and I don't want to talk to anybody because I've been talking all day and I just want to sit in a quiet room. But I got into Ohio State after my first try. They said I didn't have enough large animal experience and my grades were a little bit lower in college because I had a couple rough semesters of very hard classes. And honestly, I think I graduated from UD with a 3.3, which is pretty low to get into vet school nowadays. Now almost everybody's 3.75 or 4.0 students, but it shows it can be done. So school doesn't come super easy to me. I have to study and work at it, but I also, but once I got into vet school, this was all stuff that I was interested in, which made it a lot easier to learn it. And so vet school was a great experience. In order to help get into vet school, I did spend the year I had off in between undergrad and vet school. I spent part of that year up in Wisconsin living on a dairy farm, working with the large animal vets up there. And I learned I never want to own a dairy farm. It's a really hard life. They were up from 6 a.m. to 10 p.m. working with the cows. But it was a great experience, and it got me a lot more comfortable with the large animals and that kind of stuff, because currently in vet school, you can't specialize. You can't choose small animal or large animal, although they've been talking about it at some of the schools, because you could get a degree maybe in the future just to work on small animals, but right now you have to learn it all. Ohio State was a great experience. We did, that's 3 years of classes, and then your last year is all practical experience. You work with the different rotations, and there's all kinds of specialties in veterinary medicine that you could go into. There's cardiology and internal medicine, oncology, any kind of specialist that humans have, we have in veterinary medicine too. So I'm just a general practitioner, so I graduated from vet school and started working. If you want to be a specialist, then you have to do a residency and an internship, or an internship and then a residency, and then you have to take a separate boards exam. So you take a boards exam to be a veterinarian, and then you'd have to take an additional one to do another specialty. There is also a veterinary technician degree that you can do. A lot of people enjoy that. I work with 5 really good vet techs. That's typically a 2-year full-time degree, or sometimes a 4-year part-time degree, and that teaches you all the basic skills of, veterinary, nursing, basically. The vet techs are like nurses for veterinarians. So they draw blood, they put pets under anesthesia. Okay. So they draw blood, they put pets under anesthesia, they help with simple testing and procedures for them. At a vet tech out of school, you probably make anywhere from $18 to $25 an hour, depending on where you're working. A veterinarian, when I graduated 20 years ago, you made $50,000, which does not sound like much now, but it sounded pretty good then. I think my tuition for veterinary school was about $15,000 a year. Now, to go to veterinary school, the tuition is $35,000. If you're paying for like your fees and your rooms and board and all that stuff, it's more like you're going to expect to spend like $50,000 a year on it. But the going rate has gone up. I think most new grads now make about a little over, like about $100,000, depending on where you work again and if you work full time. So a lot of people who graduate from vet school nowadays are women. We're probably about 75% of the vet population, of the new grads anyway. I think it's because it's an 8-year degree, and we don't make as much as like MDs and pharmacy and law and all the other like advanced degrees. So I think you have to do it because you really enjoy it. But I kind of a backup was maybe considering going into human medicine, but for some reason on people, I find things like, I don't know, a cut on a person is gross to me, but a cut on a dog is fine. I just want to have like, oh, I can sew that up real quick, we'll be fine. And also, I like that I can do a little bit of everything in veterinary medicine. Like I don't have, if a general practitioner, human doctor, you're just seeing patients in an exam room all day. I get to do surgery, I get to do, puppy visits and old dog visits and old kitty visits. And so it's a lot more well-rounded, so you get a little bit of everything, and it keeps me on my toes. So I have worked, my first job out of veterinary school was in a mixed practice. I worked for about 2 years up by Cleveland, and I worked on every kind of animal. We had someone who had a bear. I did not work on the bear. We did tranquilize the bear when we worked on him. We had some people who raised elk, but mainly like dogs, cats, horses, cows, pigs, chickens, you name it, we saw it. I did that for a couple of years, and I decided that I didn't want to get called out at 3 o'clock in the morning all the time because I was on call on my turn. And then I moved to Cincinnati, and I worked for a corporate company. I ran a veterinary hospital. I did that for about 6 or 7 years, and then I moved to Pittsburgh and worked there for a little bit, then back to Cincinnati, and I've worked at an emergency clinic and a couple different, like just privately owned veterinary hospitals where a veterinarian owns it. That's by far the way you make the most money as a veterinarian. If you own the practice, you get a cut of what everybody else makes you too. The place I currently work was owned by one veterinarian, but it has gotten bought out by a corporate company about 3 or 4 years ago. It hasn't changed anything of what I do day to day. So I'm currently paid on production. So I'd never recommend that to people who are fresh out of vet school. You want a salary because when you're a new vet, you're going to be a little bit like slower, and you want to make sure you have a guaranteed income to pay off those school loans. But now I can choose kind of how many hours I work, and I get a percentage of the revenue I bring into the practice. And so if I want to earn a little bit more, I can pick up a couple more hours. If I want to work a little bit less and do things with my family or something else more, then I can do that too. So, and then I'll just open it up for any questions, and you can ask me anything you want.
When you were at high school, you worked at a veterinarian thing. What did you do there?
So there I was an assistant. So I did everything from, I did some reception work, like I'd answer the phones and check people in and out. And then some of the time I would just help hold animals, while the vet was doing something to them, giving them vaccines and that kind of stuff. Mm-hmm. I also cleaned. I was anything gross that needed to be cleaned up because I was the youngest one there. Mm-hmm. If a dog pooped on the floor, that was my job, unfortunately. When I got to the point where I worked at an emergency vet hospital, they actually taught me how to draw blood, and I learned how to start IV catheters, and that was a lot more exciting for me because I honestly worked for a vet even before high school a little bit. I would volunteer there, so I'd seen how 2 vets worked and practiced all the time, and then it was really cool to go see at the emergency clinic, number one, all the emergencies, because then it's whoa, this dog got hit by a car, and what do they have to do? And it actually, when I was first out of veterinary school, it helped me a lot, because if something came in that was an emergency, like a hit by car or a dog whose stomach's twisted, I'd think back to, okay, well, when I worked as an assistant at the emergency clinic, the first thing that the doctors asked me to do was this. So I would do that, and by then my, doctor brain kicked on, and I could be like, all right, now we have to do this and this and this and this. So it just kind of gets you like comfortable and just learning the basics, and also making sure that you want to do it, because a lot of people are like, oh, it'll be so cool working with the animals, but there are some days where it seems like every dog and cat's trying to bite me, and it's just like a really rough day, or a bad day where like I have a couple of pets that I'm really attached to that we have to euthanize because they're just suffering. And those days I'm like, oh, like it's hard. Like you have to find some kind of outlet or way to kind of like let that go so that you don't. But I've also been exposed to it since I was younger, and I loved it. There's days that you cry, and the days you go home like, wow, this was a awesome day. We saved something, and it's really cool. So yeah, and most vet hospitals you'll have to be either 16 or 18 to work there, but most of them will let you shadow at least, and like go and follow them around for a bit if you're persistent and keep asking, because we get busy and we get kind of we have someone shadow. Well, they send some people from Carroll, usually almost every year, down to shadow me, but I'm in Cincinnati, so it's a little bit trickier. But a lot of places, the harder thing to do is shadow a large animal vet. You almost have to like know someone who uses, who's a client of theirs to talk them into it, because they're so busy and they don't want anybody. Probably the liability is bigger too because of the horses and stuff. So, but definitely at least try to shadow so that you know what you're getting into. There are not many days I come home clean. I get peed on a lot by scared animals. What else?
So when you're in vet school, what content are you learning? Like, do you have to learn the anatomy of like
every animal?
Every animal?
In anatomy class, they have you dissect. We dissected dogs and horses. And then they had, we learned about everything like in a book. And I think they do a lot more virtual now, where it's like a lot more computerized than when I went to school. But then they did have a day where they had, somebody had already done the dissection, like for chickens and pigs and cows and sheep and all that, so that we could see all of that. Most of it, if you wanted to do anything with like the, pocket, like rabbits, guinea pigs, those kind of things, those are more electives that you take, which I did take because I wanted to see them, but I'm now suddenly allergic to them, as I think, I don't know, somewhere in my 30s I became allergic to them, and so I can't even be in a room with them anymore. But yeah, you learn the anatomy of everything. There's a lot of similarities, so like carnivores, like dogs are mostly carnivores. Dogs and cats have some things that are very similar, whereas like horses and sheep and goats are somewhat similar. Actually, horses and rabbits are very similar too. And then like the farm animals have, because they have a similar stomach, horses and rabbits. So
they are genetically related.
Yeah. So you learn like the basics of everything, and then kind of based on what you want to go into, you can take electives that push more of the stuff you're more interested in. And I never really planned on being a large animal vet. When I was interviewing for jobs, the guy was a super duper salesman and talked me into it. And I'm glad I did it, and I'm glad I did it right after veterinary school, because that's when my knowledge was like the best. I think I could go still treat a horse now. The only thing I'd probably be horrible at is taking x-rays of their legs, because it's just like the angles are just so precise. So, but you learn it all, and then, so most of it, you learn as much as you can in vet school, but really the first couple years of practice, you learn so much more, just because that's when you're seeing everything for the first time. You see all the diseases, and you see, we're boring Hamilton. You see like, you see the, your first week, you'll probably see 3 dogs with an ear infection. So then you're like, oh, well, now I can handle an ear infection. Let's move up to something a little bit different. So, and there's a bunch of really good vet schools out there. So, I mean, Ohio State is obviously, if you live in Ohio, it's the easiest one to get into for an Ohio person, because most of the spots are given to Ohio people. They usually do, like states that don't have a vet school usually have a contract with another one to accept a few spots. But I mean, I have friends that were from Ohio that went down to or, went down to Auburn and other schools, or Purdue is a good one too. There's a ton of them that are really good.
Would that be through like the agricultural program or something at
Yeah.
OSU?
And if you want to go, like Ohio State, a lot of people go into, you can almost have any major in undergrad and get into vet school. You just have to, there's a list of classes that you have to take for vet school. And most of it's like, you have to take chemistry and like basic chemistry and biology and biochem, and some math courses. But you can take those even as electives if you want to major in, you can major in anything and still do it. You just have to, and they publish the list of classes that are required, and most vet schools are similar enough that it's not a problem. My biochemistry degree from UD, I had everything I needed for Ohio State except for I needed one more physics credit, so I took like a lab in physics to get that one credit that I needed. And I took it my senior year, and I took like a freshman physics lab because I'm like, well, I just need a credit. Like I don't want to take a hard class. I just want to meet the requirements. So, but you can major in ag, you can major in pre-med, a biology, animal science is a common one that people. But you could be you could be an arts major and still probably take enough of the science classes that it wouldn't be a problem.
Is it a 4-year or a 2-year degree?
For veterinary school,
Yeah.
4-year. So you
I just
can.
Googled veterinary schools and a couple of other ones came up, like Columbus State Community College.
That would be for a vet tech program.
Okay.
Yeah. And that's a 2-year degree. Vet tech is 2-year for the most part, and there's a huge need for vet techs because.
Otterbein also is on here.
Yeah, and that's also that would be vet tech. You can apply to veterinary school after 3 years of undergrad. So some people do that, and I would recommend it because if nothing else, it gets you like a trial, like turning everything in and maybe getting an interview, and then you can finish your undergrad degree while you go to vet school because some of the credits for vet school should like cancel back and finish it. That saves you a year on tuition, but on most instances, unless for some reason you're like the ideal person, they're probably not going to let you in the first try. So, but don't give up. Like at first, I thought, I'm like, what am I going to do? And honestly, I had a year off in between undergrad and veterinary school, and I worked for an orthopedic veterinary surgeon, an emergency clinic, and a regular vet, and I also traveled and had fun. So I'd work 3 weeks, and then I'd take a week and go somewhere fun and travel and explore the U.S. And so I'm it all worked out for a reason. I was a little bit out of practice of sitting in the classroom after that, but it was still well worth it. So.
Do you think going to do a vet tech, would that help you get into a
vet school?
school?
And I think you can use the 2 years of vet tech as some of the prereqs for vet school. I think it gives you a better idea of what you're going to be doing in veterinary medicine and make sure you're really sold on it. And then also, you could also work as a vet tech while finishing up your prereqs and getting, and even in vet school. You're not really supposed to work in vet school, but I did. So although I worked at a restaurant, I waited tables because I could work a short shift here and there. But most places love, there's not any vet hospital that wouldn't love a vet student to come work on their, we have them that come back that work on their school breaks, or there's no one local, but for a while I worked at a vet hospital in Columbus on the weekends and stuff but then I just decided I could make more money waiting tables to pay for more vet school. I was trying to graduate without too much debt, which now, I think nowadays you have to kind of just accept that there's, for any college there's going to be debt. So any scholarship you can apply to, any grants and stuff, do it. And there's all kinds of ones out there. And even your local, the Dayton Veterinary Association probably gives scholarships too. So I know we do in Cincinnati. So any little thing helps. And then when you graduate, at least now you're going to make more than twice what I made when I graduated. So. Any other questions?
How would you recommend going about becoming an assistant or something?
So if you have pets and you take them to a veterinarian. I would try there first because you have kind of a relationship with that place, and ask them, well, can I follow you? And then follow for a day or so. Hey, I'd really like to work some after school or on Saturday mornings to get some experience, because I'm thinking of going to vet school. And most places, I know most places are all short people. And once they get to know you, I think they're a lot more likely to give you the assistance. So if you go and job shadow them once or twice, then they're a lot more likely, hey, this is a good kid, I think, they'd be very helpful. I find the people that are interested in going to vet school are kind of the ideal, and except for that they leave eventually to go to vet school, like they're the ideal hires because they're gung-ho, they want to learn the stuff, they want to do, they ask good questions, and it's like fun to, it's fun to teach people who are interested in stuff. So they tend to work hard because they want to have, references, and they want to know what they're doing. So we hire a lot of pre-vet people, and yeah, the sad part is when they get into vet school and then they leave, and then we don't, then we lose them, and that's a good employee to lose. But then maybe they'll come back as a vet. We have one that comes back she goes to school in California, and she comes back for her breaks and works when she's visiting her family, and we love her. But yeah, I would ask them first, and if not, ask one that's like close around, like convenient, from where you live, or or around here, to that if they need anybody. So anything else? You missed part of it, so you can ask anything you want.
I said that you were like for large animals.
I did large animal for the first 2 years I graduated, and I did have a lot of experience before, or a fair bit of experience before. Large animal, I'm glad I did it. It was fun. There were some days where you were out, like my best day ever. I was at a picnic or a barbecue. I got a call. I was on call. I go out to this farm, and it's a miniature horse having trouble delivering a foal. The foal pops right out. When I pull it, stands up, starts nursing from the mom. The family's little kids are hugging me and like cheering. And then I went home and took a shower and went back to the barbecue. And it was like 70 degrees and sunny, and it was wonderful out. And then I've also had a day where somebody's barn caught on fire and their horses got burnt. So I got a call at 2 o'clock in the morning from the fire department looking for a large animal vet. And this was like right after I graduated. And I'm like, well, I guess I'm a large animal vet. And they're like, so I drive to the house, and it's a draft horses. So they're Belgian draft horse. They're like 2,000 pounds. They're scared out of their mind. They have like burns on them. They don't teach you in vet school what to do about burns, but I had a great coworker, and we had a pact, because I was more of the small animal person and she was more of the large animal person, and we made a pact that we could call each other anytime, day or night. So I had like 10 burnt 2,000 pound animals running around because the barn's burnt down and there's nothing to contain them with. And I called my friend, and she's like, oh, I'll be right there. And it was also like with wind chill, like 10 below, and I'd lost a glove somewhere. I don't know. So she brought me new gloves, and she came and she helped me treat all the horses and get them some pain meds. And we found a neighbor who'd let them go to their barn, and the ones that were hurt severely enough, we had them sent to a more equipped, like a veterinary hospital that could actually hospitalize horses. And the other ones that were more mildly injured, we just came in and were treating day to day there. So that was like probably my most stressful day as a large animal vet, because I'm like, well, I don't really know what to do. I'm like, well, pain meds, I can give them that because it must hurt. And then I'm like, and then we put, I'm like, and then it's always good to have good mentors that help you through stuff, because there's a lot of stuff you don't learn in school that you have to learn like on the fly. And the first place I worked there were 5 vets there, and they were all great. Like and that's a definite important thing when you take a new job as a vet. It's like somebody who wants to help and teach you, because you're not ready to do everything the first day. So, but I did it for 2 years, and then I got kind of tired of being called out at 2 o'clock in the morning, and things trying to kick me, and I decided to move back to the city. I also was far away. I was like 4 or 5 hours away from my family, and I decided to move a little closer. And although there's still large animal work around, I live in Cincinnati, and some of my friends from vet school actually practice in Cincinnati as large animals. So, what else?
What are some of like the craziest pet names you've ever had?
Oh,
Some of them are kind of nuts.
we have there's one named after, there's a dog named Lettuce. And I'm like, and I'm not, and it's a beagle named Lettuce. There's a lot of like people who name their pets after like the anime stuff, which I don't know any of those names. I'll be like, I don't even know how to say this name of the pet. But then like someone that I work with will be like, oh, that's a character from this anime, and this is how you say it. And then I have to try to remember. There's a lot of weird, my names for my pets are so like boring. I had a chocolate miniature poodle named Hershey. Oh, big surprise. I was also 12 when I got him, in my defense. And then my other standard poodle was named Jackson. So I'm sticking with founding fathers and presidents, so he's Hamilton. And then I have an Irish water spaniel, and he needed an Irish name, so he's Declan. But mine are boring, but like people name their pets, I mean, lots of things after food. And then yesterday I don't remember what it named. It's like an ancient Egyptian mathematician that's like because we had to Google like what the pet's name was, because we're like, it sounded Greek to us. We're like, it's probably a Greek goddess or something that we just haven't heard of. But it was some ancient mathematician, and the person who owns it is a math professor at Sinclair University. So I'm like, oh, well, that makes sense. So I like it when they have unique names, because I mean, we get a lot of fluffies and, brownie and, but I mean.
What's the most common name you've seen?
Oh, for cats, probably Fluffy or Tiger. For dogs, a lot of Buffies. Like anything that's light tan is Buffy. But yeah.
One of my friends has like a white miniature dachshund, and its name is Corn Dog.
Corn Dog, that's cute. Well, see, dachshunds maybe should be named after hot dogs, because they are kind of shaped. And in Cincinnati, they have a wiener dog race every year, and some of them come in costumes dressed as hot dogs. So.
That's great.
My friends' dachshunds participate in it. Yeah, I like the crazy names, and and there's some interesting clients too. Like there's some people that, at first you're like, I'm like, once you catch on, like we have one guy who's afraid that doesn't want you to touch him, but he wants to be touching the animal while you're examining it. So it's like this, like massive, like he's trying to avoid your hands when you're trying to do stuff. And you get used to everybody's little quirks. I mean, everybody has quirks. I do too. My quirk is coughing. Like when people cough for some reason, it just makes me like cringe and want to run away. And we have some interesting little old ladies. I, for some reason, have a whole following of these they're all sisters. They're all related to each other, and they all have these dogs that are like 18 years old, and they think these dogs are going to live to be 35. Like they'll do anything for these dogs, and I see at least one of them every week with their dog with well, he's limping. I'm like, well, if you were 105, you'd limp too. I can't fix it. So for some reason I have this huge collection, and they're all related to each other. They might be like cousins and sisters, but there's this huge family that comes to me, and I don't know how they get these dogs to they all live forever. And I mean, they might not be looking great when they're limping into the office, but then they'll come in for something like that. I'm like, he's been limping for 4 years. It's, I mean, unfortunately, I compare it to my dad. My dad's uses a wheelchair. He has neuropathy. I'm like, a lot of dogs get neuropathy in their back legs as they get older due to arthritis in their spine. And I'm like, he walks like my 86-year-old father. The dogs shuffle their feet just like my dad shuffles his feet. I'm like, they're a higher fall risk. It's very similar to human medicine, which I drive the MDs crazy when I go to my family's doctor's appointments, because I'll say something and act like I know what I'm talking about. And they'll ask me if I'm a doctor, and I'm like, well, I am, but not the type you think. But a lot of it's similar, so.
What would you recommend as a good family dog?
Lab or golden retriever if you want something big. If you want something little, Havanese. They're becoming a lot more popular. They're a companion dog, and they are just energetic enough that you can take them for a walk, but also content to kind of lay around and be kind of lazy. I've had poodles my whole life, but he looks good, but he is not normally this calm at my house. He's usually running around. I did, like, a lot of the small breed dogs I like. I like the little terriers and stuff too, like the little Westies and fox terriers, but those have like more like oomph. Like they might give you a little more run for your money.
I have a Karen Terrier.
Yeah, my brother had a Karen for a while. It gave him a big run for his money. It wanted to be the boss of everything, but yeah, I don't. And with right now, it's so popular with all the poodle mixes, the doodles, and some of them are like the best dogs in the world, and some of them are just, I don't know where they pick up the weird qualities. Not from, like, I'm like, how do you mix a golden and a poodle? And this dog's like really naughty. I'm like, both those breeds are nice. Like, how does that work? But they're really popular now. So, and it's harder because you can't always guess what breed they are, and the people are very offended if you guess wrong because they all look like little curly dogs. They all look kind of like him. But my first pet as a child was a poodle, so I've always had poodles. My brother was very allergic to dogs, so they are pretty hypoallergenic. Like, he does not shed at all. And then my water spaniel sheds just a little bit. And I got kind of hooked on the not being covered in hair. I had a cat, but she passed away. Her hair was everywhere, but the only cat that doesn't shed is the Sphinx ones that have no hair. And they're cute, but in a strange alien kind of way. But I got really hooked on not having to clean up all the dog hair. My friend has labs. When her labs come to my house, it's just like hair explosion. So since I'm covered in hair all day at work, I like to come home. And plus, the poodles are really good. I don't know, they're like kind of clingy dogs. Like, he wants to like be near me or be pet or like touch me. So like really good I got him purposely to be a therapy dog. And so like it's a breed that all my poodles before like have liked every person, and they like very sociable. So that's why I picked him. My spaniel I inherited, and he gave me a huge run for my money. I thought I knew how to train a dog. He's a sporting breed, and he's 12 now, so he's calm, but he was very hard to train. He was good. He was about from 2 to 5. I'm not sure I liked him very much, but now I love him again. Like, I had to run him like 3 or 4 miles every day in order to keep like just my house like not in mayhem at all times. And he does not like strangers, and he does not like strange animals, and he does not like anything out of his routine, which this guy's the opposite. Like, he loves everyone. So sometimes you don't know what you're getting and you have to work with, and every dog you can trains differently and acts different, and you have to, same thing. And when I'm examining a dog, some dogs don't want you to like restrain them at all, and then I'm spending my time like trying to look at them while they voluntarily stand still. Whereas some dogs, you can just touch their collar and they stand perfectly still, or some of them are motivated by food. Some of them are so afraid they're sitting underneath the chair for the first 5 minutes of our office call, and you just have to like find out what works for them. We keep track in the patient's charts, like, this pet doesn't like to be restrained, so we'll restrain him if we have to do something that requires restraint, but otherwise we try to do it we try to make it as least stress. Cats are harder because most cats are stressed at the vet, but we actually have like pheromone spray that we have in the room that kind of like relaxes them. And then sometimes we will use some calming meds that the people give before they come if the pets are really stressed, because I feel horrible when they think I'm trying to hurt them when I'm just trying to listen to them with a stethoscope, and it's really hard. Yeah.
When you like get like surgeries or like see like the blood, does it ever make you queasy?
It did. The first time I watched surgery when I was shadowing the vet, I almost passed out, and I think they saw me get really more pale than I already am naturally. And they're like, sit down, and I almost put your head between your legs, and I almost passed out. Now I'm fine with it, but at first it was hard because I guess I'd never really seen much blood before, and at first I'm like, well, am I going to be able to do this if I pass out at the sight of blood? I didn't actually pass out, I just came close. But when we have people come and follow, if they want to watch, a lot of people want to see us do surgery. There's not a ton of blood most of the time, there's just a little. And I tell them, I'm like, okay, but the rule is, if you feel it all, like hot or lightheaded or anything, you have to sit down right where you are. And some people do get queasy. I think you get used to it after a while, and at first, a drop of blood seems like, oh my gosh, that's a lot of blood, and then you're like, oh, it's a drop of blood. And most surgeries actually don't bleed very much, because any blood vessel that bleeds, you tie off, and then it stops bleeding, or you clamp it. So spleens, on the other hand, I'm the only one in my practice that likes to remove spleens, so they set them all up for me, and those hold all your extra blood and cells, so those a little bit more bloody. But I worked at an emergency clinic for like 5 or 6 years, and I got more used to it there, but at first I was very queasy.
What would you say your paperwork level is like?
Our charts are all computerized, which is nice. I've worked places where they're all paper, and then they get lost and stuff. Although our computers went down for 2 days recently, and so that was fun too. I tend to write all my charts as I go. So most of my appointment schedules I have 3 appointments that are 15 minutes long, and then I have a 15-minute catch-up period. So if something takes more time, or we have to run a test or whatever. So I try to see the appointment, write the notes, see the next appointment, write the notes. Or at that 15-minute catch-up, I can write it. I've gotten pretty efficient at it. I find that if I write everything as soon as I do it, then I remember everything a lot better. I don't have to sit there and think and like, oh, was it his right leg that he was limping on, or his left leg? And my staff also writes some of the history that the people give them in there. Surgeries, I'll probably do a couple surgeries, then I write their notes. So I probably spend a third of my time writing stuff up, or putting like charges in the computer, and then 2/3 of it actually working with the animals and the people. So it's not that bad. Once you get used to it, like you get like a system for how you write it. Like every exam I do on a pet, I start at their head and I work my way back. So that's how I write my notes. I do like, okay, their teeth, their eyes, their ears, and then I work my way down. So then it's easy for me to remember like what to write about everybody. So and that way I also don't skip a part of the animal when I'm doing the exam. So unless the animal's really afraid of me by its face, then I'll start with like the heart and lungs and work my way back, and then go to the head last. So, because some of them, it takes a while for them to warm up to you enough to let you look in their mouth without them trying to bite you. I barely ever get bit. I haven't been bit in years, honestly, knock on wood, or I'll get bit tomorrow. But I'm pretty good. You get good at reading them, and if a dog looks like it wants to bite me, and also we keep track in the records if they've nipped at people or tried to bite. A lot of times we just slip a muzzle on them just to be on the safe side. Because I don't want me, and I don't want my staff to get hurt more so than anything, and I don't want the clients to get hurt either. And sometimes the things that we're doing aren't comfortable. And any dog or cat could bite if something hurts. I think if something hurt bad enough, if Hamilton broke his toe and I'm feeling it, I don't think he'd bite me, but he might. And so if I think something's going to be painful, then I make sure either I have someone to help hold them, or if it's going to for sure be painful, then we give them some pain meds first so that it doesn't hurt so bad. But you can't tell them what hurt, ask them, well, what part of your leg hurts? Why aren't you using it? So you have to feel for a reaction, but you also learn to go in gently at first in case something's broken, and then if they react to the gentle, then you're like, okay, we can stop there. We know we need to take an x-ray of the foot. If they don't react, then you can be a little bit more assertive and check all the joints a little more aggressively, because depending on their pain and their tolerance. So.
Is the small animal school and the large animal school 2 different things?
It's the same thing. So when you go to vet school, you learn about everything. Now, they were talking about changing that, but they have not at this point, to my knowledge. They were talking about having a separate large animal and small animal degree, but I believe they're still combined now. So they make you learn it all, and then you can kind of choose what you go into, but you can choose your electives based on what you're more interested in. So if you're like, I want to be a horse doctor, then you can take a bunch of electives for equine and not take as many for like dogs and cats and rabbits and stuff like that if you don't think you're going to see them. And then if you change your mind later on in life and you're like, now I really want to be a rabbit doctor, there's continuing education, there's other courses you can take. We have to take continuing education. I have to get 30 hours every 2 years to make sure that I'm staying up to date with everything. That's to just keep my license. So, but it's usually, I mean, those are usually fun because you can go to things that you're interested in or things you think you need to, you know, work on. So like last summer I went to one about surgery, like different surgical techniques. And I mean, I've been doing surgery for 20 years and I'm like, well, I learned something here. I don't know, but he was one of the surgeons that taught me at vet school, and yet he had new ideas now 20 years later. So it was awesome because I'm like, I never thought of doing it that way. Like, there's a million ways to do something. And so I'm like, next time I do that surgery, I'm gonna try his method. And I'm like, wow, it's so much easier. You know, whether it's an incision in a slightly different area or something that just makes it go smoother. And that's why I like to work with different people and stuff as I go. I've worked at a bunch of different practices. Part of it's because I get a little stir crazy and I'm like, well, I want to try something different. And part of it is because I like to work with different people because everybody has different ideas and different or they were taught at a different vet school that teaches something slightly different. I'm like, wow, I've never heard that. And nowadays there's easy, we have a website where if you have a question, then you can just type it in. And if someone's already asked it, then it'll show everybody's responses. And a lot of them are like the specialty doctors that will answer the questions. And, you know, I'll be like, wow, well, I've only seen, I'll use it if I'm like, well, I've only seen one case of this ever in 20 years. I know what I treated it 10 years ago with, but maybe there's something better. I'm like, now I can just pick everybody's brains at my fingertips, which is so much nicer. You guys are very lucky. When I graduated, I had a book that I had to look up every disease in if I needed help with it. It's nice to have all that information, but then you also don't want to rely on it. So you know, at first, our new grad that I work with is on there all the time, looking, or she'll ask us if we're not busy to help her out with stuff. And then as she's gotten a little bit, you know, more, you know, developed, she now doesn't have to look at it nearly as much. But it's nice to have a backup because there are things that you don't ever they're diseases. You're I think I remember something about vet school. There was one day that they talked about this disease. And I think this is it. And I'm and I've never seen it before. And then you call everybody else that, you have to look at this. This is the weirdest thing I've ever seen. But it's, and that still happens now, so.
Where did you work during vet school, and then after vet school, were you able to start doing surgery and stuff?
Yeah, so during vet school, actually, I waited tables at Outback Steakhouse because I could make a decent amount of money and work a 4-hour shift. I did work at a vet hospital the first year of vet school up in Columbus, and a lot of Columbus vet hospitals will advertise to get the vet students. They'll advertise at the vet school to get people to work. But they always wanted me to work longer shifts, which I needed time to study too, because as I said before, I have to study hard to learn the stuff. I'm not one that can, I don't know, I can't remember it the first time I have to study. Then when I graduated from vet school, I wasn't sure if I wanted to come back to Dayton, if I wanted to move to a different part or totally out of the state. When you graduate, you get a license, you take a national boards exam, and there are some states you can get a license in just with that, and some of them you have to take an extra test. So I've been licensed in 3 different states. Currently, I'm only licensed in Ohio because that's the only place I work right now. But I went around and interviewed a bunch of places because I'm well, I'm not sure exactly where I want to be, so I might as well look to see what's out there. And the first job I took was the mixed practice, and there they were great. My mentor, he'd been out of vet school probably 10 years. His policy was, okay, the first time you watch me do the surgery, and then I'll scrub in and watch, and you do most of it, but I'm here to help. And then if you're comfortable then I'll be doing some other work, but on call if you need my help with it. And so I learned, they let me do a ton of surgery, which I really enjoyed, because some places, when they hire a new grad, they're well, we're gonna wait a year and then let you do surgery. But you do some surgery in vet school, but not enough to be confident in it. So you need someone who's gonna stick with you if you need help. Now, if it was a harder surgery, I'd get their help a couple times before they let me do it. But if it was something like, something pretty routine, like a little lump to remove off, the skin, then okay, I can probably get by with them showing me once, me showing them that I can do it, and then them in the next room in case I like think I hit a blood vessel that's big when it's like a drop of blood, but I'm nervous still because I'm new. And that they were excellent. They let me do a lot of small animal surgery, and I wasn't super confident as the large animal vet when I started there. And in the beginning, I rode around with one of the other vets for a while, and also to introduce me to some of the clients. And then they started me off on, okay, well, we're going to go to these farms and like do vaccines and well checks. And then they bumped me up to doing like more of like, okay, now here's a sick cow that you have to go see. But if you need help, then you can call us, And so they were always the backup, and they were great. I lucked out. I had a great first job. I worked there for 2 years, and then I started running a vet practice. I was the only vet there for a corporate company. But I had friends in the area that I would call for consults. I'd be like, can I send these x-rays over to you and have you look at them too? Because I don't have anyone as backup. And most vets are like, we all work together. I'm friends with a bunch of them in my area that I graduated from vet school with, or in similar years that I saw there. And they, like, it's kind of like a big team, like, everybody helps each other out. And now I like working better in a practice with multiple doctors. And for a new grad, that's the only option, and definitely with someone who wants to like mentor you, because I don't know, the first time you see an ear infection, you're like, well, there's like 10 different meds. How do I choose the right one, and that kind of stuff. So you need somebody to ask at first, and then after a while they won't tell you as easily and make you tell them what you think you should use to see if you got it. But yeah, my first job was great. And I didn't even plan on being a large animal vet. And somehow they made it seem like it was always going to be the 75-degree days with like the good outcome and a cute baby horse. And but it was definitely a learning experience.
If you go to vet school in a different state, does your license, does it go to like the state that you like live in, or like would it be like?
You can get a license in pretty much any state that you want. So most of the states accept the national board exam. So most vet schools give the national board exam. When I went to school in Ohio and got my license originally in Ohio. I got a license in Minnesota because I went up there and worked for a little while. There I had to like take a state little test just on like the different rules of being a vet in the state. So they basically gave me a booklet to read, and it was an open book test, and I took the test, and they're like, okay, here's your license, because I already had a license in one state. If you know you're going to move back to, like, if you're going to go out of state for school and then you know you're coming back to Ohio, then you can make sure that whatever you're taking at the end of vet school qualifies you for a license in Ohio. And then I've been licensed in Pennsylvania too, and Pennsylvania was the same way. At that point I had practiced for about 10 years, so they're just like, yeah, here, take this rule, like it was, again, state rules. California and Florida are the hardest because I think people want to move there more because it's, nicer weather. And so they have their own boards exam that you have to pass. So I've never been licensed there because I don't want to take another board exam now. It is hard. And you get more than one try to pass it. I passed it on my first try. I think one or two of my classmates didn't, and they were like people who were nervous test takers, so they took it again and passed it just fine. Vet school pretty much prepares you. I mean, the stuff they ask you on the boards is the stuff you need to know. So it's kind of like taking an advanced, SAT or ACT. So for some reason, I was always good at those, but my grades in class weren't very good. In fact, going into vet school, they're like, well, we know you're smart. Your ACT and SAT scores are great. Why are your grades like not so good? And then to get into vet school, when I applied, you had to take a test to get in. Like you had to take, there's a VCAT. The MCAT is what you take to get into medical school, or you could take GRE, which is like to go to like get your master's in something. I took the GRE because it's the easiest one of them, and I figured, why go for the hard one? And nowadays you don't have to take an entrance test anymore. They don't even want you to send it to them if you take it. So that part didn't bother me because, again, in vet school, my GRE score was good, but my grades weren't as good. So they're like, well, we know that if if I apply myself, I can do well. But I mean, I was always like a good student, but not great. Like I don't know what my GPA graduating from Carroll High School was, but I was not a 4.0. I did take a couple of like the higher level classes, but I'm someone who has to work for it. And in college it's a little harder because I also did work probably 20 hours a week at a vet hospital. I probably worked more than I should, and my grades probably would have been better had I not worked, but I wanted the experience, and I also needed the money to pay for school, so you do what you got to do. Anything else? You guys have good questions, though.
It's 12:12, so it's almost
Oh, good.
12:15, so thank you for everyone's questions.
And if
thank
you have
for
other
being
questions, yeah, you can. Julie knows how to get hold of me, so you guys can have my email address. Don't email me at work because I don't answer those, so I only answer my personal email. You want to go say hi to everybody, Ham?
I was gonna say, now you can see the dog.
I think the food's it. No, go say hi.
Here. Thank you again.
Oh, you're welcome.